Please upload the slide of Jignesh sir, the pearls for setting up practice for a fresh graduate. I think
Yeah,
that is a very important topic.
absolutely. At the outset, I would like to thank Dr. Namrata Sharma and her team for allowing me to speak and give a keynote address to this UC group. Friends, everybody goes to the teething stage. So I have my 10 pearls. For those who have started practice, I have tried to target one age group. I'll just be disclosing that. What you need is proper financial planning and budgeting of the session, searching for an appropriate place, then which instrument are you going to invest in. You see, the ophthalmic instruments range from a lakh to a crore. So you really need to budget it out. Then staff recruitment, your presence on social platforms, institutional association and attachment, observership at seniors and teachers center, your association with the neutral diagnostic centers, the neutral OTs, on-rent instruments, on-rent machines, and on-rent OT. Honing of skills for newer treatment modalities, upgradation and upscaling of infrastructure and instrumentation. On this 10 pearls, one by one, I'll try and cover it, and you'll see to it that you can set up your practice comfortably without stress. Even I have gone through all this, so this is nothing mentioned in any of the books. So the target audience I've taken is 28 to 35. Everybody completes their post graduation by 27 to 30, depending upon their age. For 28 to 35, first you have to decide your priorities and your goals. Whether you'd like to do super specialist training or you would like to start fresh right away. Setting up of your professional practice, you either have a small office or you have a full hospital premises, depending upon the funds. Equipments also, the basic and the advanced. Residential property, insurance, you have Mediclaim, it's very important nowadays. Term insurance, FBAS, AIOS, we have it with the All India Ophthalmological Society. It is a family benefit scheme. Professional indemnity. Then savings, shares, FDs, mutual funds, gold, and real estate. We'll touch up to each of this individually. Vehicles, what you'd like to have, a two-wheeler, four-wheeler to start with, and of course, marriage. In financial planning, you need to work out the approximate cost of the infrastructure. भाई पैसा है तो सब कुछ है, हर एक चीज़ पैसे से काम करती है. As a general ophthalmologist and as a super specialist or a subspecialist, you have three options here. If you have good enough amount of money, you have a family backup, then you buy the place right away and buy on self or on loan and install the equipment. If you have no money, for the infrastructure, you rent out a clinic. You have a rental clinic and buy the basic equipment and take advanced instrument depending upon your subspecialties. And if you have no money at all, then you go in only for a rental clinic and rental instruments. Budgeting. How much allocation are you going to put for each of this? Now, day-to-day expenses you have the EMIs to pay because you don't have cash in hand. So you have to repay the loans. The staff that you have to pay them. Margin money for buying new equipment. Any equipment you buy, any bank gives about 15 to 20% of your margin money that you have to put in, and 80 to 85% is what the banks chip in. Then for the Mediclaim, life insurance, professional indemnity, you have to make arrangements for that. Your daily utility expenses, telephone, cell phone charges, MSB, property tax, professional tax, biomedical waste. If you plan to buy a house, then the housing loan comes up. Then you have personal expenses, paying income tax. I would recommend everybody to start paying income tax on day one because that is your white that you're going to build up and which is going to help you later on whenever you are planning to buy advanced equipment which is in crores. So if you have a good white build up, you have very good chance of getting loans from the banks easily. And then do file, that's what I've written. And you build up your white as required for the margin money. Then saving FDs, mutual funds, shares, gold, and real estate. Setting up of the infrastructure. If you have funds, you buy it straight off. Otherwise, you go in for rental. If you are doing ownership, again, you have bank loans, and if you have financial backing from your parents and relatives. You have to pick up a proper real estate agent who has a good reputation for both rental and for the ownership. Loans are available by the nationalized bank, the semi-nationalized bank, and the private banks. Nationalized bank give you cheaper interest rates. It's almost 1 to 1.5 less than what you are available with the semi and the private banks. The processing fees are also very cheap, but they are very, very poor in services. You have to wait in the lines, your work is not done, you have to physically visit. Of course, days have changed now. The private banks give good services, but the interest rate is almost 1.5 to 2 more than the regular interest rates. We have two types of loans that you have, a floating interest and the fixed interest. In the floating interest, what you have is it keeps fluctuating year to year, month to month. So if the interests are very high, then it is always better to take a floating interest loan, because then it is going to come down and you're going to get less and less interest to be charged over your EMI. But if you have fixed interest rates, whatever you have, suppose the interest rate goes to 6% or it is on 12%, whatever you have bought at that pre-interest rate, you have to pay. So be very choosy at the first itself. Later on, they don't allow you to change. Equated monthly installment. What is an equated monthly installment? It takes the capital into account and the interest that is paid. Banks are there to earn. So they are going to collect their interest first. So the interest component is higher initially and the capital component is very less. So for an initial person who has started the practice, who doesn't want stress, you have to take on a staggering basis the loans that you are going to take over a period of time, and take it for a maximum period. So you have lesser amount of EMI to be paid. For any loan availment, you have to have proper budgeting, and a project report has to be prepared. If the bank lends you money, you need to submit a blueprint of your earnings and how you are going to grow over the next 5 years after taking care of the expenses. As I just told you, the margin money is between 15 to 20%, 25%, depending upon which bank you approach. You have what you have to generate and pay at the time of the loan disbursement. No bank gives 100% loan unless it is a personal loan. But then if it is a personal and unsecured, the rate of interest is very, very heavy. The margin money comes from your savings, from your help from the parents, relatives, and friends. Always and always go for a nationalized bank. As you said, the interest is lower. Because even say you buy this thing of 10 lakhs and the interest is around 10%. So you're paying 1,000 per lakh. So you're paying 10,000. That is the amount of interest you're going to pay. And that you spread out over the period of 1 year, divided into 12 is the amount of interest that you're paying per month. So it does count. Even a 2% and 3% on a 50 lakh loan works out to be in thousands. So in initial day of practice, it's very difficult to avail all this. So be very choosy, go to a nationalized bank and go in for it. So that is the lowest rate. What is moratorium? Moratorium is a period where you are not paying the EMI at all. Some banks give for 3 months, some give for 6 months. Because the moment you buy an equipment or an infrastructure premises, you don't earn the very next day. So they give you that interest-free, capital-free area, the EMI free over a period of 3 to 6 months. You ask them, the more is better for you, and after that the EMI starts. That is how it is. So again, go for the moratorium and staggering payment. Staggering payment is initially you have, say you have taken a loan of 10 lakhs, your EMI comes out to be 50,000. So you tell them initially, let the EMI be 25 over a period of 2 years, then you make it 30, 35, 40, 50, 55. As your practice grows, it is easy for you to pay and there is less stress on the mind. The project that you prepare, the blueprint that you are going to submit, it's not going further, boss. आगे नहीं जा रहा है. Okay. Arranging the finances. Never take a credit card loan. I don't know how many people use the credit card. The interest rates vary from 24 to 36%, 21 to 36 payment. And even if you're 1 day late, the full interest is charged. Suppose you're taking a 50,000 loan into 36. So that is about 18,000. So 1800. So 1800 is charged, say on 7th is your due date. On the 8th, they'll charge you straight away. Forget about the rest. And that starts building up. So don't try and skip any EMI as the interest starts building up. Initially, interest component is more, as I just said, the bank wants to earn from you. And the capital component is less. Always take loan on a daily or a monthly reducing balance. It is available as annual, it is available as monthly and on a daily basis. So daily basis works the least. I mean, taxes the pocket, the list. Ask the bench which type of year they're giving. Always go for the nationalized banks. I've given the list of the nationalized banks which give you loan easily. Why it is important? Searching a place. You need to decide first whether going for the ownership or rental. Ideally choose as per your budget. Points to be kept in mind, it should be easily approachable by all modes of transport. Very easily accessible, it should be either ground floor or first floor, as we have most of them are the geriatric patients which are walking in. 3, it's in the close vicinity about the ICU. If you have any emergency, you should be able to shift in a very quick time. Of course, enough parking place, paid or otherwise. Now that you're going to pay EMI, you know how to do the generation of income. So your income on OPD, diagnostics, your procedures, operations is one way. Then you have professional income from your institute which you have joined, which you attached the same sources. Then you can have an optical shop and you start earning on that. Contact lenses and low visual aids. Optical shop, I'll tell you, it's very good as an earning source. अपने को 600 रुपये देने के लिए या 1000 रुपये देने को तकलीफ देती, there they spend about 5,000 and 10,000 easily. So if you have an optical shop outlet, it is a very good source of income. Generating more surgeries at a discounted rate by conducting free diagnostic camps at your center once in a month, that also not on your OPD days but on a Sunday, a non-working day. Visiting peripheral rural areas by conducting outreach eye checkup camps in rural area once a week, fortnight, month, thereby having a surgical inflow from such camps to your main center. Please let me know when to stop. Huh? No issues. Huh? Conducting paid subspecialty training, wet labs, tutorial classes for PGs. That is another way of having income. You have your articles in newsprint, lectures in NGO, radio, TV, public awareness programs for the better outreach to the general public and becoming a face in the crowd. Equipment, again, as I just said, 2 options, basic equipment by loans and rest you can have group practice. In our centers in Maharashtra, in Sangli, they have a very good center which has come up where they have group practice and they're doing very well. So join a group practice by contributing and then sharing returns proportionately. Suppose 10 lakh, 1 crore ka hai and you put 10 lakhs. So 10% is the proportion that you are going to gain out of it. Buy basic and take advance on rent. But this option is not available all over because rental instruments, see, we have YAG laser available, we have perimetry available, we have OCTs available on rent. But maybe in other centers it's not available, so you have the options. Keep it in mind. When you buy an equipment, the conferences are the best place to have this. Then you have a group of people who can buy the same common equipment. You have the bargaining and a trading power to get the equipment of your choice at grossly discounted rates. In case you are an individual, you would ask the seniors, your instrument ka kya hai, what is the testimonials about it, and then you should buy. Bundling offers are, of course, there for the major instruments when you have tie-up, but you be very, very cautious on the overall deal that you have with these companies because they try and cover up and see that the whole equipment is what you're paying for. Which equipment to invest initially? In the rural areas and the tier 2, tier 3 cities, but what you have is the OPD chair unit, slit lamp, autoref, keratometer, direct, indirect, tonometer. Rest of the instruments you buy as per your subspecialty. If you're a glaucoma consultant, you should have a perimetry at least, minimum autoperimetry to be there. OCTs if you are a retinal surgeon. And of course, accordingly to your subspecialties, you should buy. For the basic equipment, an OT table, motorized with a surgeon chair, a phaco surgical instruments with SICS. Said the Indian ones are very good at highly discounted rates as compared to the imported ones. Rest of the equipment again as per your specialty. OPD and OT equipment and instruments usually to be bought in a conference, as I just said, you have very good quality and it doesn't compromise on the quality. Staff recruitment is very important. As a solo practitioner, start with a bare minimum. Your front desk, you have a receptionist which takes care of the patient's outflow. You take mock training sessions and train them the basic etiquettes and how to deal because that is the face of your clinic. Handle patients with various temperaments in a good way. They being the face, they should be able to handle it very nicely. OT assistants, you can have a dedicated OT assistant or you train the reception part into it because you have just started, so you don't want to shell out more money in this. So you can have it that way also if you have an inbuilt OT. Then you have a maid and IR to take care of the cleanliness. Tip is you have to have a trained OT assistant specifically mentioned for the ophthalmic purpose, because there are OT assistants but they are for the general purposes. So train them for that, so they be very, very useful. Unskilled, according to, you can pick up the unskilled also because they require less salary. Mainly, I am talking about the rural and the semi-rural areas where multitasking is there by a single assistant. Your presence on social platforms. Well, in today's world, if you are not on the social platform, you are not in the race. You should be on the Facebook, Twitter, Instagram, and WhatsApp. Have your own website. It's a big, big boon. Blogging is equally important. All this help you have a virtual presence then. Post your things, the latest events, your happenings of the center, updating of the skills, receiving due recognition, appreciation, awards by renowned societies and world over. Showcase your professional and personal talents on all platforms. Please don't post videos showing face of the patient without the explicit consent of the patient. Best to avoid. The another source of income is your institutional attachment, which gives you wider reach. You reach, now I have been attached to about 3 institutes. The number of patients increase exponentially. Also, interaction with the fellow consultants, you have cross referrals there, and that also grows your earnings. Emergencies, house calls, in casualty. Keep your surgical hand at work, especially initial phase of solo practice where cases are very few. Joining a charitable institute is another way where you hone your skills and have a wider acceptance. You need to fine tune and balance your central work with the institute. Ultimately, it's your own center which is going to give you this. So, devote more times to your center. Observership at your teachers and senior center. Best is to do a proper fellowship. If you have planned out either in retina or refractive, whatever you feel you are best in. As a general ophthalmologist in an initial phase, for more confidence in this, please keep attending webinars, then regular wet labs, observe surgeries as the teachers and colleagues whom rate in high esteem. Physically attending gives you a better advantage because you see the OT setup, how he functions is, the small hand movements that are seen, how he uses the foot pedal, very small little things, but it will go a great way. These are good pearls that you pick up from the ophthalmic surgeon, a reputed one. Yes, for the surgical steps, numerous videos are available on the YouTube. Of course, intricate here, you can keep rewinding and see and master each and every step. You tie up with the nutritional diagnostic and OTs, as I said, to save costs without compromising on the quality of surgery. For beginners, I recommend to have a tie-up with all well-equipped centers who allow you to do diagnostic tests, your procedures, your operation as a predetermined rate. You work out the logistics with the center, ask for this so you know what are your expenses in that neutral center. So you save on huge investments. You require less investment in space and equipment. Also, you can join like-minded colleagues to have a neutral center, put your own contribution, and have the best of the equipments, infrastructure, OT, and support staff, all at a fraction of a cost which would you have invested otherwise. Honing of your skills for newer techniques and modalities. Majority of the surgical vendors are ready to allow you to use their newer machines. Of course, Alcon has also already started fellowship where you can do your hands-on training. Short observership is also very good. Hands-on teaching with newer techniques and surgeries are also available. Of course, our very own YouTube also has all the new techniques where you can pick up, see and clear doubts, and also on WhatsApp. Upgradation, upscaling of your infrastructure. For growth and being at par with the best in your area, you have to decide a timeline to add on the advanced equipment from time to time in a staggered manner. For having all the new machinery, you need extra space. So expansion of your center, either in the add-on or a separate entity in the adjoining premises for convenience of functioning, has to be done as and when the fund and space is available. Proper training and know-how of the operating newer machinery has also to be kept in mind before installation, usually done by the vendors themselves. Now, residential property. You have to decide if you have funds initially, you can start buying it, but this thing is always try and see that your professional practice develops very nicely. You have enough money to buy a house. Of course, go in for an EMI because the home loans are very, very cheaper. What you get, professional equipment is 13.5%. Home loans are available at 9 and 9.5%. So almost 4% less. Usually no separate security required as home itself is the mortgaged by the bank. So the lower interest is applicable. Loans disbursed are almost 85% of the total value. 15% is your contribution. and it is 20 times your net income is what you get. And the payment period is also almost 10 to 20 years. It's not 4 or 5 years that you get for the medical equipment and this. Insurance, you should have Mediclaim, friends. I see younger generation at 30, 35 having heart attacks and all. So you have a good cover. The base insurance, the base installments are very less. Now, as of today, I am 66, so I am paying insurance of, say, about on 10 lakhs, about 50,000. For the same of 10 lakhs, you pay only 2 or 3,000 initially. So start having Mediclaim insurance from day one. Family floater is you and your whole family. Say I'm taking 20 lakh loan and I'm getting a 20 lakh insurance. I am paying an EMI of only about say 40,000. So that covers all the five family members, whoever are there. Anyone can claim in that, or till you exhaust that amount, whatever you have asked for. An individual. Professional indemnity is the in thing nowadays. You should be fully backed up because there are lawyers who can take care of your this thing. Term insurance, of course, security for your near and dear ones, you should have. Investments. Now you say, Baba, अभी तो नया नया practice शुरू किया, invest क्यों करूँ मैं? No. You should save at least 20% of your income as savings. Either in FDs, either in the saving banks. Saving bank, of course, it doesn't beat the inflation. Suppose if it is 7%, you get 3.5%, so you're losing money. So there's no point keeping in the saving bank account. Put it in fixed deposit. Best are the corporates. It's very safe, and the interest rate is much better than the nationalized banks. Shares, equities, and futures. Of course, the way you do ophthalmology, you have to study shares. They give you fantastic returns, almost 120. In the last boom run, people have earned almost 100. 1 lakh ka 2 lakh ho gaya ek saal mein. Where you have, if you keep it in bank, it takes 10 years. So that is the type of returns you have in shares. But initial stage, you have to have a proper allocation of your funds. Say if you have 1 lakh of fund, so only 10 to 20% of that should go into shares, not more than that. In case you plan to have a second option, earning option in a much better way, like you have in private practice. And mutual funds, that is the steady income that you have in mutual funds. There are debt funds, there are equity funds, there are hybrid funds and all. So you work it out, take a financial consultant initially, they'll help you out how to work it out. Last 2 minutes. Now, having a vehicle, of course, is very important. Without a vehicle, so in the rural and taluka places, two-wheelers suffice. If you're close to the house and this, you should have it. Buy a new one if the loans are given for that. But keep it as a second option. And marriage, of course, I would say keep it after 5 years of it when you have reasonable income for your household expenses, personal, professional EMI, and day-to-day expenses. Saving around 20% of your annual income. So thank you very much for patient learning. Sorry to overshoot, but I wanted to explain because
Yes, sir. It's a very important. Yeah.
small little tips over my 30 years, 40 years of my practice. I've
Yeah.
tried to put it into one